Good afternoon. Happy Thursday, March 7, 2024. Happy March. It's like a little bit of rain outside, but isn't it gorgeous the last few days and this weekend? Excited to see spring, excited to see the blooms starting to happen, and we all know it's going to freeze again, but it's still beautiful out there, and just happy spring. You sprinkled a lot with it. March was a great month for Titus County and for Titus Regional Medical Center. I just want to thank everybody who participated in the many activities. With February being cardiovascular month, there was things happening from day 1 to the 29th day last Thursday. So things were going great. I want to thank everybody who came out to React Quicker, Save Your Ticker Health Fair. I want to thank the TRMC team members who were there, our vendors, and care workers in the community that showed up that day. It was a good event, and it was good to see people. We had a lot of people stop by and just thank me for the ability to come and get their lab work done and meet the different opportunities for improving their health. So a lot going on in Titus County, and so it was exciting to see that day, and we'll look forward to that. And we've also are spurring a few more health fairs around the community as well, based on things that are happening in that one and others. So we're excited about that. A lot of things going on at the health center in March, and our whole deal is about zero harm, and we're wanting to improve patient safety, improve our quality scores, and we've made huge improvements from COVID. What Kathy and the medical staff later in March, they called embargoes, but we're excited that we're going to be announcing a few quality and patient safety achievements. I'm so excited for our team and the work that they're doing, that we can brag on them a little bit this month. So stay tuned to some press releases that'll come out over the next few weeks, but also when we do this update in April, I'll be sure to mention those as well. So thanks to everybody involved in that, and we're excited. One of the ones I can mention happened last week in Austin, and our maternal team was in Austin for their coalition and for Texas Mother and Babies, and they were recognized for their response and to postpartum preeclampsia in the emergency department. And I want to give a shout out to our emergency department for the work that's going on there and the collaboration they're having with our second floor labor and delivery and nursery and NICU. These two units have worked closely together, the physicians on both sides and nurses on both sides and the team leaders. A lot of work going on. And I was blown away the other day when Cheyenne shared in our leadership huddle just the number of mortalities that happen in emergency departments across Texas of mothers and babies, and mothers that we lose way too soon. So the work that's going on in our emergency department and the second floor, kudos to them. 900 plus births a year. So it happens a lot here as far as those births, and every day you'll hear the lullaby over the things. But TRMC was recognized as one of 5 hospitals in the state of Texas. And you can see those other 4 that are mentioned. Those are large health systems. Those aren't just little push hospitals. Those are some of the best in the state of Texas. And to be recognized by the maternal group as one of those top 5 hospitals and the work going on with preeclampsia in the emergency department, congratulations to those team. The passion they have is shown in there. So excited to see that. And my wife is on, so I'm glad to see Angela joining us on this thing. So hi, babe. Wednesday, March 20th, Lunch and Learn. We're excited. Dr. Fleming's going to be joining us, and Kathy Griffiths, our Chief Nursing Officer, talking about the emergency department and show the transformations in the last year. And one of the things I've been so proud of this year is the work that these teams are doing. You saw it in the previous award I just mentioned, but there's a lot going on down there with cardiovascular and other cardiovascular strokes, fixing to have some behavioral health things that we're meeting with today. So we're excited about that. But the work going with our emergency department is just amazing. So we're excited to bring Dr. Fleming, CMO of the team that we work with. Him and Kathy are going to talk about emergency department, things that happen, things to expect, but really just kind of talk to the crowd that day at our Lunch and Learn. So please join us on March 20th. It's a week later than normal because of spring break. It's a great lunch, $5. You can't beat it. But please join us on Wednesday, March 20th. We're excited about that. I'm going to go ahead and bad news here. So if you don't want to hear it, just turn your sound down. But this Sunday is Spring Forward. So for those who enjoy their sleep and enjoy their Saturday night to Sunday night, if you show up on normal time on Sunday, you're going to be late to church. So Spring Forward this Sunday, it matters in the hospital world too, is all those medical records have to spring forward as well. So don't forget this Sunday, Spring Forward. I know you all look forward to it as well. March is Colorectal Cancer Awareness Month. And guys, it doesn't surprise you ones who watch this community update and have followed Titus Regional Facebook and know me and Angela. Me and Angela have been battling together colorectal cancer since October. So this is the first time that we've gone through Colorectal Cancer Awareness Month. And we just want to remind you and share, I've been blessed. I've been blessed by my family, my wife and my family, and my friends and my coworkers here. But just to learn the process of cancer and just how it affects people and the doctors and the work that they've done. We've got a lot going on here at the Cancer Center at Titus, and our general surgeons across the board here at Titus, we're excited to have them. But as we talk about Colorectal Cancer Awareness Month, I can't do this community update with not encouraging you that if you're 45 years or older, get your colonoscopy done. It's not bad. It's easy. We're making it easier every day. The number there that you can call and not have to have that appointment now. So quicker to get in, quicker to go ahead and get that colonoscopy if you meet certain criteria, so you don't have to miss more than that day of work. So we're trying to make it easier. I will tell you, there's not a prettier colonoscopy lab in the state of Texas than the one we have on the 3rd floor. So they do a great job, and I've gotten compliment after compliment. Got a text last week from one of our local government officials that was blown away just about the care he got on the 3rd floor from our GI team. So if you have not scheduled a colonoscopy, 45 years and older, please get that done. We'd love to walk you through that screening, be a part of that with you, and take care of you and your family. We were blessed. We caught mine early, and I'm so lucky because of that piece of it. Now I'm encouraging my friends and I'm encouraging you to take advantage of Colorectal Cancer Awareness Month, and let's get that colonoscopy done. I'm going to end today just in remembering Royce Carr. We lost Royce previous Sunday, and it was a surprise to all of us. Had the privilege to join many of the people at Mount Pleasant last week to attend Royce's memorial service, and our prayers on behalf of the board, the executive team, and all of Titus, our prayers and condolences go out to Miss Deborah and the 3 boys. Royce was a board of manager for the Titus County Hospital District for more than 7 years. I've known Royce in the 20 years that I've lived in Mount Pleasant. He has been a friend to both me and Angela and have made a difference in our lives for many years. Royce has been a blessing on our hospital district. He was passionate about being a board member for this hospital district and wanting to make sure that this hospital district provided quality local health care for this community. Our goal is every day is to remember him and to continue pushing forward in creating a world that he'd be proud of. But we're so appreciative of the friendships that Royce made and the work that Royce has done. And we just wanted just to thank him for all he's done. He was a friend and he will be missed. And again, our prayers and just deepest sympathies to Miss Deborah and the boys as they're going through this time of remembrance from there. So on the behalf of the hospital district, thank you for all you do. Thank you for support of our health system. Spring breaks next week, which means basketball season. It will be, the tournament will be started, so we'll all be busy from there. And then when I come together in April, get ready. It's eclipse time. So I'll have all my eclipse PSAs ready for you, and hopefully we'll have my special glasses but for April 8th as the eclipse comes in Northeast Texas and we try and limit those damages that an eclipse can happen. But again, on behalf of Titus Regional Medical Center, thank you for the opportunity to serve you, our community. God bless.